Hi, everybody. My name is Vladimiro Vida, and I'm a full professor of cardiac surgery here at the University of Padua. I'm the chief of the Pediatric and Congenital Cardiac Surgery Unit at the Azienda Ospedale Università here at Padua. And also I'm the director of the training program in cardiac surgery here at the same university. Today, I'm here to talk about our last published book, Congenital Hearts, a virtual atlas of congenital heart disease in prenatal and postnatal life. The main focus of this textbook is the teaching of congenital heart diseases with the aid of advanced cardiac imaging and the use of 3D reconstruction and virtual reality. Since 2018, we started here at the University of Padua to use 3D reconstruction and printing to plan our operation and to improve the communication with parents and patients before surgery, since we were not satisfied fully with the value of classical 2D images. On the wave of our initial impression with the enthusiasm of this new methodology, we decided to expand the use of 3D reconstruction and printing for the training and teaching of congenital heart disease between our residents and trainees. The following idea was to write a book with the purpose of providing to young people who were approaching to the world of congenital heart malformation, such as medical students and residents and also trainees or young doctors, a very intuitive and visual way of learning, which were including a 3D figure from 3D reconstructions and also video showing the anatomy of real heart with congenital heart malformation with the use of virtual reality. We believe that this book can represent a very useful tool, not only for very young people, but also for professionals who were taking care of patients affected by congenital heart malformation. The book itself includes 20 chapters, each for a specific congenital heart malformation. In each chapter, there is an initial brief description of the congenital heart disease, divided into a definition, a clinical presentation, and speaking about the type of surgical repair for that specific congenital heart malformation. And then we have one or more case description, which were done on real heart anatomies, which included the outside and inside view of the heart. The outside view usually is a front view, a rear view. The inside view includes cuts of the heart, mainly from 2D echocardiography, including a short axis view, a long axis view, and a 4-chamber view. And also at the end of each chapter, there is a video where you can have the possibility of exploring the heart from a virtual reality navigation. This is interesting because the pitching editors provide an application for smartphone or PC or Mac, which is downloadable for their website, where each reader can have the possibility to scan a code from the book and to have access to a video, which actually is a virtual reality navigation done by myself, with myself explaining the heart anatomy from outside at the beginning and also from inside, just showing the details of this the congenital heart disease we were talking about. So I think really this book is a very new thing, exploring a new methodology of teaching congenital heart disease in a very intuitive and innovative way for the reader to come close to the world of congenital heart malformation.